And hello, everyone. Tonight, well, as Scott mentioned, we always start a little bit of topic. I have one tonight, and then we can talk about anything people would like to talk about after that. The topic I don't really choose. They kind of come to me, and this one came to me today, and that's patience, and kind of what role patience has in recovery, and maybe why it's hard sometimes in recovery, and so I'll talk a little bit about that and some things I do to help me with when I get impatient. But when we're in active addiction, patience is not something that's very easy for us to do, and that is really because our midbrain, that limbic system that we've talked about before, is really an active, very stimulation. That's the part of our brain that really is kind of the instinctual part of our brain. It is ruled by emotions, not rational thought. It knows what it wants when it wants it. And if we are in our addiction, that part of the brain is really what's guiding what we do. And that part of the brain has no patience. It has no waiting. It has just about what it needs and wants. And it's very impulsive. It has very little impulse control, which comes from the frontal part of the brain, the higher part of the brain. So we're overstimulated when we're in our addiction. And we have to really learn how to kind of compensate for that in recovery. So behaviors of an addict, really, we can see it reflected in a lot of the irrational behavior, the impulsive behavior. People make decisions they don't think through. They just jump into stuff. And also oftentimes they jump because they want it right then and there. So there's this urge for instant gratification that's really driven by this limbic system. And it outranks qualities like patience or empathy, or worried about the consequences of what we might be doing on other people, that kind of thing, responsibility. All those kind of the higher level, higher function tasks kind of get thrown aside, and when that limbic part of our brain is ruling when we're in addiction. So what else we know that kind of goes with this is with addiction, there's a lot of intensity and a need for intensity there. And so the limbic part of the brain, we're in addiction, is always looking for more and more and more. And so when we're not feeling stimulated, we often feel distressed or even anxious, which is why boredom and empty space and indecision and those kind of spaces in between are so hard for addicts. And that's another reason why patience is hard, because we want to fill that space. If we're feeling like we don't know something, we jump to it. If there's some open space, we get bored, we feel uncomfortable, we want to fill it with something. And so learning how to just sit with our feelings, learning how to sit and be patient is hard. And it's a skill, I think, that we really need to be learning. The other thing I'll mention in this regard is the role of boredom. Boredom, to me, I think, is one of the biggest triggers there is. And I learned that the hard way dealing with clients, because I didn't recognize boredom as a trigger until I had a lot of meth-using guys start to relapse because things were going so smoothly in their lives that things got well, and they need a little drama to shake it up. So boredom really is an uncomfortable sensation for somebody that's a sensation seeker that needs that intensity. The lack of intensity can be painful and feels like depression or some kind of emotional pain. It hurts. And so I think people need to learn. It's a skill, again, to learn how to sit with that. So it's really important in recovery for us addicts to work on patience skills. And I think sometimes even the things we do in program is very staged and paced. So working the steps. There's a lot of slogans that encourage us to kind of sit back and just take it one step at a time, one day at a time, and just this too shall pass. Just kind of these things that help us cope as we're dealing with that pain, the lack of intensity. So waiting in line, anything we can do to kind of help us understand that the reward will come later, because we're really retraining our brains how to be impulsive and seek that reward right now, that instant gratification. We learn how to kind of delay it and defer it. And that really is an incredibly important skill. And it strengthens our ability to manage impulses. Remember that midbrain, the limbic system, is really ruling everything. And so we have to kind of retrain to invite our prefrontal cortex, which is our higher brain, to kind of step back in and be the adult in the room and kind of say, whoa, no, that's not so good. That gallon of ice cream looks great, but we let's have a glass of water instead. That's no fun. So exercise is another way we do it. Exercise not only is good for us, but it also, we have long-term gains. Sometimes we're not in shape. Sometimes we have weight to lose. None of that can be done overnight. And so it's another way to kind of pace ourselves and learn this sort of slower, more, I guess, say healthier pace of recovery. Future goals. I mean, how many of us in recovery, I went back and got actually a couple master's degrees in recovery, but doing something, finding purpose, finding goals, finding something that keeps us going, that gets us up in the morning, a passion, even service. Those things are seeds that are planted, and we don't get the reward right away. We certainly get it, but I think it's another skill and kind of it slows down the pace of what we're doing. And finally, just some practical skills. I always talk about breathing, but I think breathing here is a really important way. If I'm feeling stressed, I'm lacking patience, I do this 4-7-8 breathing, which is inhale for 4, hold for 7, release for 8. There's other breathing ratios and formulas, but I like that one. And it really resets your physiology out of anxiety into kind of a more patient mode. Relaxation, learning how to relax, progressive relaxation, or that's kind of squeezing parts of your body and relaxing, or just doing a mental relaxation. I sometimes will take 5 minutes in my office and just kind of close the door and just close my eyes and just really drop into a state of relaxation as best I can. And finally, if everything else fails, we have a great tool in 12-step program called the Serenity Prayer. And that really helps us, discern what is it we have to worry about now, what can we just put off, and what do we have no power over anyway. And so all these kind of skills come together. And I never really put them all together in terms of how they all really serve this bigger purpose of kind of learning how to slow down our lives, how to live with more intention and less impulsivity. And so that's my 2 cents on patience. As I mentioned at the beginning, we can talk about that, or we can talk about anything people would like to talk about. And so I'll throw it open.
Yeah, for those of you who joined us late, our topic today is patience, but you can ask questions about anything to do with addiction or recovery. The easiest way to do that is the Q&A feature at the bottom of your video screen. You can also use the chat feature, but it's not quite as anonymous. So this is for you. We want to answer your questions. So please ask us questions. To get us started, David, maybe you can talk a little bit about the structure of the brain, kind of the inner part of the brain, and then the midbrain, and then the outer part of the brain, and the difference between, say, a lizard and a cat and a human.
Okay. I see the cat running around there too. So.
Yeah, she's very midbrain right now.
So the midbrain, this limbic system, the reward circuitry, it's the deep inner part of the brain that evolved first. It's very instinctual. It really is guided by emotions and survival. It's all about survival. So that's where the dopamine reward circuitry is based, which gives us a little burst of dopamine when we do things that help us survive as a species. Everything from collaboration and shared tasks and falling in love and sex and all those things that keep us going as a species. So it's really all geared toward that. It's geared toward fight or flight. So if it feels something, it wants to move right now. It needs action, or it plays dead. But most of the time we go into this fight or flight thing, and we have physiological changes with adrenaline, and our pupils get big and our limbs get a lot of blood flowing to them so we can run or fight. And so this mid part of the brain where addiction lives is all about this kind of primal energy. It has no time stamp. There's no windows. And so everything there is unrelated to time. And that becomes important with trauma, because when people have an experience of trauma, as most addicts do, that all kind of gets frozen in that midbrain, in this fight or flight system. And so a lot of people with trauma have this chronic stress thing going on where they're constantly in this fight or flight mode, and trying to kind of battle things that are no longer a danger. But the other thing is that with no timestamp, if something gets activated today in the here and now that reminds me of some trauma I had in the past, the response is just as if it were happening right now. And so that's where a lot of this impulsivity and lack of patience for addiction comes, because this is all driving the addiction. Addiction really lives in that system. over that are several other layers of the brain, but the big one is the prefrontal cortex, which is the front part of the brain, which evolved later, which is where all the circuitry is, a lot of wiring, and that's where a lot of our consciousness of self lives. It's where our ability to do abstract thinking, it's our ability to predict the future as opposed to just responding because we sense a danger, to say, well, that's not so dangerous. This happened once before, and I was able to do this and this and this. Where we can collaborate, we can we use our higher order thinking. And also this prefrontal cortex is where we have the skill to say no, to say, no, this isn't a danger. No, I don't need that right now. No, I don't have to do this. I have these other options. So really, when we get into recovery, we're really kind of strengthening that frontal cortex and putting it back in charge. And interestingly, with the new scanning techniques we have, we know now that addiction not only messes up some of the circuitry in the limbic system, that inner brain, but it actually starts to sever the neural pathways to the prefrontal cortex. So with active addiction, the brain is kind of cutting off the part of our brain that thinks in more abstract, good ways. And it's really sort of, we're stuck, we're kind of trapped in our own brains with this limbic system that's in fight or flight mode all the time. So part of recovery is really reestablishing good connections with our frontal cortex, which gives us the ability to have patience, to defer, to say, no, that's not such a good idea, and to plan. So, yeah.
And humans are separated from other animals because we have a much more developed prefrontal cortex. Is that correct?
That's correct. And that gives us the ability for language and abstract thought and this consciousness of self, where we know we're different. Some animals, I have 2 dogs, you have a cat. I mean, I think they have quite a bit of personality themselves, and but I think they lack a certain awareness that humans have about each other.
So when we're active in our addiction, we kind of de-evolutionize our brains. We kind of take a step back in time.
We regress back into this kind of primal fight or flight thing.
Yeah.
And that's why an addict is going to, I always talk about an addiction. Their primary relationship is not with their husband or wife. It's with their disease, right? They're with their drug or their behavior. And that's what they protect, at all cost. And in fact, we know from sex addiction how impactful and hurtful it is on partners. Empathy, you can guess where empathy is in the brain. Empathy is in the frontal part of the brain that really gets turned off in this addiction.
Yeah. Yeah, I mean, we often get asked about, particularly sex addicts, are they even capable of empathy? And the answer is yes, but we've got to open up some pathways to get them there. I mean, it took me years of recovery before I was truly feeling empathy rather than kind of going through the motions, one step at a time to get an approximation of empathy where it just started happening. It was several years of recovery.
Right. And I will say too that mindfulness, the practice of mindfulness and meditation really do help speed that reestablishment of pathways between the 2 parts of the brain. It does help.
Once again, everybody, this is a webinar for you, and it's a Q&A. So ask some questions. I can ask questions for an hour, no problem. But I want you to ask the questions that you have. But while we wait on somebody to ask some questions, and I know you will, I'll tell a story about me and patience as an addict. At my 90-day mark, I had made a friend who's still a very good friend, and he had, 25 years at the time, something like that. And well, he's 27 because he's about to take 42. Is that right? Anyway, whatever. He had 20 plus years. Let's leave it at that. And I was taking my 90-day chip, and he got me a card, and it was a very nice card. And I was like, "Oh, this is so nice. Somebody actually cares enough to, about me, God forbid, to do this." And inside the card, it said, "Here's wishing you a long, slow recovery." And God, was I pissed. But now I get it. I wanted to be well, and I wanted to be well yesterday, and that just wasn't happening and never happened. And I'm glad it didn't happen, because the journey of recovery is much better than being recovered, I think. I think being recovered would be boring. I like the journey. I like to learn. So,
right.
okay, question. I've mentioned going out on a few dates here. I feel like I enjoy my time with him, but I'm not sure there's an actual romantic attraction. People are recommending that I continue to get to know him and see if something builds. Do you think after 3 or 4 times hanging out with this person, I should have felt something at this point? And I
Um,
believe this person has identified in the past as a love addict, but I'm sure I will be corrected if I'm wrong, but I think that's the case.
okay. I find this is a really highly individual thing. There's no rule on this. A lot of people have like a 3-date, uh, you know, make it or break it kind of rule. And I think it just really depends on chemistry and where you're starting from and the two individuals. So I think when you say feel something, I'm not sure exactly what that means. If there's a history of kind of a romance addiction, then I'd be careful about that. Um, there is something, again, that comes out of the kind of midbrain called limerence, which is that thing where you fall in love with someone and then we're basically it's an intoxicated state. Our brain has all these chemicals floating around that is actually kind of a dangerous time. It's designed to bond us as human beings to when we form a couple, but it can be problematic because you can be forming a couple with the wrong person and be totally blind to all the red flags that are screaming at you because you're kind of in love. So when I have clients who experience that too soon, I worry. When there's nothing there or not sure, I would just give it time. I would say, do you enjoy this person? Do you have fun? Is it a nice time? And that's good enough for quite a while, I think, to carry it on to see what happens. But I don't think there's a rule, and I wouldn't have a number stuck in your head. I would go more with trying to discern what you're feeling and what you are looking for intention wise. And just I would try to keep it casual and fun and not try to put a rule on it or a time. Now, if it goes on and it starts to feel forced or unpleasant or uncomfortable or weird, then that's the time to do something. But if you're enjoying yourself, I mean, there's also just we can enjoy the company of other people without having to have it lead somewhere or put a label on it. I think a lot of times my clients will say it's kind of the kiss of death, and when one or the other of them wants to label what it is. Are we boyfriends or girlfriends or dating or and that kind of puts this pressure on it sometimes. So I would just enjoy it and be open and have fun and trust your instinct.
Yeah, dating is all about patience. It's great that our first question was about dating because, as David mentioned, limerence, that tends to kick in pretty early. At least it does for me. I think, ooh, yummy, and and I'll ignore all the red flags, and I have to be patient and get through that before I find out if there's something more important there than just that zing. And yeah, and dating again is another aspect of patience in dating. Is you're gonna go on a few dates with some frogs before you find your prince or princess. That's just the way it is. And you'll meet some lovely people. I've met some lovely people who are friends and have stayed friends, but it wasn't a romantic fit, but there was a friendship fit. So yeah, be patient and keep your eyes open for red flags. But yeah.
And I would add, in my own experience, dating when I was new in recovery, I didn't know what I wanted, and I was often attracted to people that, after a couple dates, weren't the kind of people I wanted, and what turned out to be really interesting people, I kind of wrote off as boring or uninteresting. And that was just me, I guess, being superficial. But I with some time and some practice, I kind of figured out what I liked. And so anyway, yeah, patience, trial and error, and yeah.
Yeah, and some people will date will only date people that they meet in recovery. Some people, like me, prefer to date people who aren't in recovery. I find, if I want to find somebody in a 12-step meeting, the odds are good, but the goods are odd. It's the old joke. So I had to figure that out, the hard way. So,
yeah.
Okay. The patience thing is cool. I often feel against a wall in recovery. I want to look for another job or anything to get a rush outside of my sex addiction. What steps can I take to avoid feeling up against a wall every time I feel challenged? Great question.
Really great question, because this really encapsulates a lot of what we've been talking about, right?
Yeah.
So addiction, remember, is all about managing uncomfortable feelings. Sex addiction is not about sex, as we've talked about before. It's about numbing or floating or dealing with something we don't want to deal with. And so patience really makes us sort of confront these things and feel it, mostly feel it. And so I think your awareness that kind of wanting to rush to do something when you're feeling challenged, and I totally identify with that. Early on, I was always looking for a different job or a different place to live or a different life, because I was just like kind of frantic about it. And so I think just learning how to sit with your feelings, and I would really, you don't mention feelings in this, and I would say really be conscious of the feelings that are going on. And I would bet there's a lot of anxiety and other kind of feelings that are triggering that midbrain we were talking about, that limbic system, into like fight or flight. And that's what it kind of feels like in your question. So I would just, those skills, some of them we talked about: breathing, relaxing, a little mini gratitude list, distracting yourself with a walk outside for 10 minutes. There's all kinds of, making a call, connecting with people is a really nice way to soothe yourself. Part of the thing with, remember I said that when we're active in that midbrain, there's no windows, right? We're trapped in there with us. And I think if we can establish a connection, even a phone call with someone, it kind of breaks that, and we get reconnected and grounded in the world. So anything you do to ground yourself. I mentioned, the breathing, distracting. I do visualization. I've talked about this before, actually. Visualize grounding cords going out of me and down into the earth and kind of anchoring me. So there's all kinds of ways to do it, depending on what senses are strongest with you. But I would just practice. And this is a thing about practice. It's any of these skills work better and better the more we use them. So I just try stuff that feels right. The breathing is really useful because you can do it and you can do it in a room full of people and nobody knows you're doing it, and it really is effective. So there's ways, but I think the bottom line here, from what I would guess, is that this fight or flight mode is all about dealing with uncomfortable feelings. So I'd really take a look at those and learn how you can process those feelings in a more healthy way.
Yeah, and I think all of the suggestions David just made, all of those will help to rebuild the pathway into the prefrontal cortex, the thinking, rational parts of our brains that we really need. So anytime you take one of those actions, if you take it over and over, you're going to wear a pathway in, and it's going to become second nature, and these feelings won't be quite as powerful. David, when you talked about boredom earlier, about how that can bring up anxiety, that still happens for me. I've been sober quite a while now. And one of the things I actually scribbled on my paper here while you were talking was, impatience is an attempt at control, and then I put in parentheses, feelings. It's the same as my addiction. I want to control my feelings. When I'm feeling impatient, it's because there's something I can't control, and I'm having a feeling. And I think that's kind of connected. So I think it's really natural that addicts really struggle with patience.
Right. And you're absolutely right. It's an attempt to kind of regain control over what feels kind of a little bit like an out of control situation. And that could even be feelings that we feel might bubble up and kind of lose that control. So yeah, definitely. And patience, what is it? It's being quiet, right? And when we're quiet, all kinds of stuff bubbles up. And so we have to learn how to sort of deal with that as it comes up, and not be overwhelmed. I think the other thing, where the addiction lives in that midbrain, everything can kind of be overwhelming. Everything's like a fight or flight. This is like life and death. And one thing I had to do in recovery was to learn to figure out, first of all, none of them were life and death, but if they all felt that way, and to kind of figure out, almost to titrate or triage issues in my life. It's like, okay, well, that, I'm hungry. That's not life or death. Why don't I eat something? That kind of thing. And so just learning how to do that is really important. Basic skills.
This is a follow-up to our dating question. Do you believe a recovering sex and love addict should stick to dating one person to see whether something develops, or would being curious about dating around a little bit be more problematic? So what's, date only one person at a time, date around a little bit? What do you think, David?
In general, I think it's useful to date several people. Now, if that feeds into your addiction, that's a whole other story. And I would really follow the guidelines of the people in your recovery group and your sponsor and people that know you. But generally speaking, I think, I wouldn't want to have married the first person I ever dated. I think it's important to date around a little bit. But if that kind of feeds into my addictive patterns, I've got to be really cautious about it. The other thing, there's an option here that you didn't mention, and that's not dating at all, right? And that's a choice people can make for a while too. It doesn't have to be permanent. But I think it was very useful for me early on to not date, because again, patience-wise, I was trying to fill the space of my feelings and kind of distract myself from me by getting involved with somebody else and kind of moving into their life and living their lives and their problems. And so it was a distraction. So that's another option, is to really just kind of sit with it and not date anybody and get to know you as a third way.
Yeah, and I think knowing what your goals for dating are, what do you want to get out of this? Do you just want to learn how to date in a healthy way, or are you looking for a long-term relationship, or are you not sure? And if you're not sure, I agree with David, just step back for a while. Nobody ever died from not dating, yeah.
And I think going back to our theme here of like intensity, early in recovery, sometimes we're kind of dating to kind of churn up everything else. And I think people can kind of get into kind of a compulsive dating situation too, where it's just another thing to be busy and avoid feelings and kind of doing the quiet work, the quiet, slow work of recovery.
Okay, this one is, all right, it says, I have been to Celebrate Recovery 4 times, which I think is a Christian group. Last night was the 4th, and I started attending their 12-step study group. Actually, there are several, about 3, I think, church leaders, including the pastor of the church where it is held. I felt like I was the only one with problems and major reactions to the questions in the 12-step group. At the same time, over the last few days, I wish there were a group meeting every night. I feel like the meeting is maybe just another escape from reality. Is this a good thing? I don't really relate to many people there. It seems like many people there are in recovery from meth or substance addiction, but there are some with sex and porn. And then the last bit, last night after the meeting, I acted out almost all night till about 3 a.m. I feel confused. Is this helping me? Is this normal? There's a lot packed into that.
Yeah. So first of all, groups are really essential to recovery. That said, I think the right group is also really important. And so it was important for me to go to groups where I felt like I belonged. And sometimes that wasn't immediate, but pretty quickly I got that sense, or that I could learn something from these people, or I related to them somehow. Now, it is classic for us addicts to compare and not identify, right? So I can go into a room of people and say, well, I'm not like him, I'm not like her, I'm not like, and just, be very lonely in this room full of people. And so I had to really often change my way of looking at the meeting to say, okay, what that person did drugs or has done things that I've never done. but what do I have in common with that person? And that attitude really helped me start to identify in a good way with people. So I think groups are essential. We can't do this on our own. Now, I am concerned that you would go home and act out after the group. I guess I would really ask you to work with your therapist or sponsor, at least, to sort of figure out what was triggered there, what was going on. Was it feeling like you didn't belong? Was it something that was said? Was it, I don't know. But obviously something strong got triggered, and I think that's important. There are some meetings that I don't go to because they're triggering for me still, and or they're not really well run. Maybe the leaders allow language that's too explicit, or they got off on topics that aren't relevant, or I'm frustrated or whatever. And so I think it's important to take a look at the meeting as well to see if that's really the right meeting for you. However, you've only gone a couple times, and I'd be cautious about that, because I think we can too quickly kind of throw out a meeting from a bad reaction. The strength of your reaction afterwards in terms of acting out tells me that, boy, some big nerve was hit for you. And I think it's really important for you to find out what that is. And I suspect it's not just about the meeting or the people in the meeting. It was something, although they may be meth addicts or whatever that you might not identify with, something got you. And so I think it's really important to take a look at that. You might also then, in the meantime, add to your repertoire of meetings, add one and see. But I think it's a mistake to, and I know people that do this, they go to a meeting, don't like it, go to another meeting, don't like it, and they never quite put down roots anywhere. And I think that's one of the essential skills of recovery and patience, is to be in one place. Yeah, Scott, do you have any thoughts on that?
Yeah, I mean, I would look into other meetings. There's probably some SAA or SCA or SA meetings in your area that you could use in addition to Celebrate Recovery meetings. The one thing I wanted to point out in this question, over the last few days, I wish there was a group meeting every night. I feel like the meeting is maybe another escape from reality. Is this a good thing? The first part of that, I wish there was a group meeting every night. That is the healthiest thing that any addict could ever say. The opposite of addiction is not sobriety, it's connection. When we feel connected to other people, we are much, much, much less likely to engage in our addiction. And you may have left the meeting and suddenly felt lonely after having felt connected for an hour or two for the first time in years. And suddenly you have this overwhelming feeling of being lonely again and wishing there was, and maybe that's why you acted out. I don't know. I mean, I always think it's important to do kind of the autopsy of a slip or a relapse to figure out what you were really feeling. But I would say it's incredibly healthy to wish there was a group meeting, to wish you could connect with people at least a little bit every night. I go to meetings almost every day because I enjoy the connection, and I don't see that as replacing my addiction. I see that as a healthy part of life. I've put down roots, as David said. I tend to go to the same meeting. I go to regular meetings regularly, which means I go to the same meetings all the time. So I know everybody, and they know me. And when something's up, we all step in and help each other. And when something's up with me, they step in and help. And that has been the unexpected joy of my recovery, is suddenly I have friends for the first time in ages. So I love that you wish there was a meeting every night. Find one. There's a meeting somewhere that you can go to online.
If not physically, online. Yeah.
Anything you wanted to add, David?
And I know from other clients we've worked with that we're going to Christian meetings that there sometimes can be a lot of shame triggered. And I don't know if church leaders in the group, there's all kinds of issues that could be there, but sometimes the meetings, when an addict moves out of their addiction into recovery, it's really moving out of a lot of secrets and secrecy and shame. And just that moving into the daylight might have been some triggering potential too. But I agree with Scott, the need for meetings I was not one that really loved going to meetings. I knew I had to, and I came to love them. So yeah, they're the life force of recovery in terms of that connection.
Yeah, and you know, if there's somebody in that group that you enjoy that person's company or think you have something in common, see if they want to go to coffee or something. You said there's a couple people with sex and porn. See if they want to go to coffee once a week, and just, you know, the 3 or 4 of you or however many, you know, get real specific about what's going on, and you'll get a connection, and you'll feel more of a connection that way.
And I'll say this too. So I don't think we have a question in the queue. Maybe we do, but
Oh, we got a couple, but go ahead.
okay. I just want to say my mistake early on, because I was so, I think, shy and just like living in a cave for so long. To go to meetings was a shock, and I would run from the meeting as soon as they closed. And it took me a while before I just hung around and connected with people. And that idea of going to coffee with somebody afterwards was terrifying to me. But that really is the heart of recovery. The meetings are great. I get a lot out of sitting in the meetings, but I certainly get just as much out of the fellowship that comes afterwards, going to coffee, going to dinner, and just talking. My sponsor even recognized that early on and said, it was before the time you could do this, but in terms of days of recovery, but he put me on making coffee like my 6th day. And it was great because there was a task. I could focus on making the coffee, but while I was making coffee, I was talking to people. And, you know, so anything you can do to kind of integrate yourself in is useful.
I love this next question because it's about the steps. Yay. We talk about 12-step recovery all the time, and people actually do work the steps. So this question says, what guidance or advice do you have for making step 9 amends? I have my step 8 list ready, but have not worked step 9 yet. Any general thoughts on this step? By the way, step 9 is where you make amends to people in your life that you harmed. So with that, I'll turn it over to David.
Wow, great question. You know, step 9 for me was terrifying. It was kind of because I moved in my recovery process from being the victim and being hurt to realizing I kind of had a role in stuff, and I'd hurt other people, and I'd caused a lot of pain for people. And so to really kind of own that was one thing, but then to have to deal with it face to face was really terrifying for me. I will say I took it person by person, and it, for the most part, was an amazingly positive experience. People were gracious for the most part. People heard me. I felt heard. I felt physically like I was lightening up. I just felt huge relief come off me. And I would say step 9 for me was a turning point in terms of how I approached my life. It really was. It was just kind of evening the scale somehow, making amends, making it right. There were a few people, and my sponsor prepared me for this, but it hurt when it happened, but it happened where they didn't accept the amends. And, you know, basically said, you really were a jerk. And, you know, okay, that's how they felt. But you know what? Even in those cases, I felt, okay, I made the effort. I'm powerless over how they react, what they do, but I felt good about what I did. And so that was wonderful. And then there were a couple times, I've mentioned before, I think here, that I got sober in New York City in the late 70s and in gay groups, and lost a lot of people to HIV. And so there are a lot of people in my life that died that I couldn't make amends to physically. And so I did other kinds of gestures or tokens for those people. And that also made me feel good. So I guess the bottom line for me, step 9 was, it felt like it was a cleansing. It was, even where it didn't work out like I hoped it would, it was actually in the end a good process for me. Scott, what about you?
Yeah, I mean, steps 4 through 9 are kind of the action steps of 12-step recovery. We start with a searching and fearless moral inventory of ourselves, you know, and we identify our part in the mess that our lives have become is basically what we're doing. And then we identify character defects that we want to work on, and we start working on them. And then we create our step 8 list, which is people we need to make amends to, and we become ready to make amends to them. So I'm guessing if you say you said you got your step 8 list. I hope you're ready to make amends to these people for the right reasons. Number one, and then when we get to step 9, as David said, most people are very receptive. Some people are not. It doesn't matter. It's not about them. This is about our recovery. And I always want my sponsees to know it doesn't matter how they respond. This is about you cleaning up your side of the street. And I also want my sponsees to know this is not just about apologizing. It's about living differently in the future. That's the purpose of step 9. And amends is different than an apology. An amends usually includes an apology and an admission of what we've done, but the real amends is living differently and making things right. If we owe somebody money, we pay them, or we set up a plan to pay them, things like that. The other thing I would say about step 9 is we make our step 9's amends unless it's going to cause injury to the other person or to ourselves. And that's important. There are people who've stolen from their work. That's a tricky one. You want to make amends, you want to pay them back, you want to live differently in the future. But if you've got a wife and kids, what if they call the police? And that has happened, and people have gone to prison because they made an amends. So a lot of talk with the sponsor before you make an amends like that, especially, but any amends I think should be worked through with your sponsor. Why am I making amends to this person? What is my motivation? And how am I going to make the amends? I think that's very important. But I love it. I love that you're doing it. I'm going to skip the next because we got to follow up to that. I haven't disclosed to family that I'm in recovery, but I will make amends to them. Thoughts on how to disclose this so it doesn't sound so out of left field? Interesting question there. I skipped down to the follow-up.
Yeah, no, I see that. So is the question to make amends without disclosing?
I think this individual wants to make the amends and knows that a disclosure that, yes, I'm in recovery is going to have to come with that.
Right.
Are there any tips on how to tactfully do that?
Okay, so yeah, so if it's sex addiction, we really talk about disclosure in a different sense, I guess, than maybe some other areas where it really needs to be a formal process that isn't something kind of just done one day, but really worked out carefully with therapists on both the partner side and the addict side, and it's done in a very formal and carefully thought out way. Now, if you're going to make an amends, clearly that does mean there's some disclosure that happens, and so with the exception of that partner issue we just talked about, the formal disclosure, in my case, I had to really kind of consider it on a case-by-case basis and how much I wanted to say. I will say my impulse at first was to say too much, I think, and a sponsor that kind of cautioned me on not telling the whole world about my situation, but being more kind of discerning and thoughtful about it. But in the case of an amends, I certainly had to reveal what was going on. But I picked carefully the timing and the situation. And in some cases, I think wanted to make sure I was considerate of the person I was dealing with, that they were ready to hear this and able to hear it, and that I gave them adequate time to process what I was saying. I think sometimes, going back to our theme of patience, we want to just kind of blurt it out and get it over with and move on, and people need to process it. We owe them that their ability to kind of take this and deal with it and have feelings and have a reaction and deal with their own process in the course of it. So I don't know. Not a great answer, but I guess it was just kind of case by case for me, and being very careful and considerate of other people's needs and feelings in this whole process.
This goes back to our Celebrate Recovery, the Christian recovery group. The individual says, I identify as gay. I'm a little bit worried about coming out in a Christian group. On the other hand, I feel like saying F it and blasting them with reality just in case they don't have it. Thoughts?
Okay, yeah. So that, yeah, I kind of felt there was something else there. So yeah, that's an issue. And you don't want to shoot yourself in the foot. I think it is important in recovery to live with integrity, right? And be ourselves. And I'm a gay man, and my addiction was all about shame and secrecy and living in the closet and not being able to be who I was. And so my recovery was all about that. And so I didn't, in my recovery group, certainly didn't want to go back in the closet. Um, I can't say what you should do in this case. If you find meetings where you identify with these people as Christians and it's helpful for you, that's one thing. I would do what's right for you and not what you think the other people need to hear, even if it's a learning how to, or discovering there's a gay person in their midst, or whatever, I think, but just move cautiously on that, because that's a whole explosive kind of field. And I think once I found my voice and felt I had my power, I was like ready to take on the world, and that wasn't always to my best advantage. But going back to what we said before about the importance of connection and roots and belonging, this may not be the group for you, but since you do seem to have some kind of connection there, I might start by sharing with a few people individually and see how that goes. I think it's important though, and maybe I'm just projecting onto you my own stuff, but it was very important for me to be honest with people around me and that they know who I was, who I am. So I think we all have to make those choices. Now, that said, there are situations where it can be dangerous to do that, or just stupid to do that. If there's maybe some economic risk in a job situation or something. So sometimes we have to be discerning, but I think as a rule of thumb, recovery is all about starting to live with integrity. Scott?
My experience, and I have not been to Celebrate Recovery, so I can only speak from AA, NA, SAA, standard 12-step meetings. People tend to be pretty accepting. I know I have one friend, he's deceased now, so I can talk about him a little bit. And I don't mean to sound stereotypical, but he was the Nelliest queen you have ever met. I mean, he was flamingly gay. And he got sober in Stockton, California, in a room full of Hell's Angels. And he was at their weddings. They were, because they just accepted him because he was in recovery. So there were a lot, and I hear stories like that all the time, but, proceed with caution. And particularly in a Christian setting, I mean, some of the most wonderful, loving, accepting people I know identify as Christians. They're beautiful people, and some of them are not. Just like non-Christians. I mean, so yeah, proceed with caution, but proceed, I would say. I think it's important.
Yeah.
So. Next one here. I am a recovering sex addict. I have 3 months of sobriety, and I'm starting to physically feel these different emotions throughout the day when I have time to think to myself, like driving to my job. These feelings are so foreign to me, and I can't remember the last time I felt these feelings, particularly from the physically feeling them viewpoint. I also struggle with my emotional intelligence, maybe you can define what that is, David. And I have a difficult time being able to identify the emotions. I know there is no true timetable for an addict to understand their feelings, but I'm somewhat frustrated with understanding these emotions, lack thereof. I have a difficult time to focus when I feel these emotions. I am just trying to better understand what I'm feeling. What suggestions do you have to identify these emotions and then become more emotionally intelligent?
Wow, great question.
Mm-hmm.
We've talked before in this webinar about in recovery when we start to wake up, right, emotionally and physically. And a lot of us, the only feeling I had when I was in my addiction was bad. And recovery was all about almost like learning a foreign language of different emotional names. And we've joked about these little diagrams of emojis and happy faces and sad faces and things like that we actually include in our patient manual, because a lot of people have to, you're totally on track in terms of this ability to kind of learn how, what am I feeling? What's going on? And so I think you're right kind of where you should be. I love the fact that you have identified the physical connection with the emotional connection, because that to me is one of the best indicators of what you're feeling. And I always ask my clients, if they have an emotion, express an emotion, where are you feeling that in your body? And I think because that, first of all, addicts, we're up here all the time. And this allows us to kind of reconnect with our bodies, which often have been, first of all, they've been right there with us, but they also were there, right there with us for all the trauma, and they hold a lot of trauma and they hold a lot of memories. And it's important to kind of bring our bodies along in recovery. So I think learning how to discern what those feelings are from a physical point of view is hugely important. And then learning how to not only identify what they are and where you're feeling it, and I would take it one step further. Pardon me, there's some background noise. I would take it one step further, and there's an old Gestalt therapy technique where, and I ask my clients to do this too sometimes, and especially the guys kind of like, what? I said, if you're feeling a pain in your throat, give it a voice. What would it say? Let it talk to you. And kind of something we can learn a lot by giving your voice. I feel cramped. I feel constricted. I feel like I'm choking. Okay, what is that? How are you choking in your life? And you can learn a lot from that stuff. So I'd dialogue with it, and I'd enjoy it. I'd play with it. But I just so applaud you for connecting the physical piece of that. Now, emotional intelligence, I think of as just this ability to discern our emotions, to make sense of them, to see what they're connected to see what they're connected to, thoughts, to the ability to express them and own them. And that takes patience, to once again go back to our theme tonight. But I think I would just be mindful. And this is where mindfulness is such a great skill. Mindfulness is just simply noticing without judgment. So you can notice what you're feeling without saying, oh, that's stupid, or I shouldn't be doing that, or I always feel this. Just notice it and make the connection. And very quickly, we start to put together this very intricate system of what we're feeling, when we're feeling, how we're feeling it, what it means, what else it means. Just suddenly we learn a whole lot about ourselves. So to me, what you're saying, you're just waking up. And I think that's wonderful. And it happens when we're quiet, like when you're driving, like you say, or when we're not distracted with life, with taking care of ourselves or our families or our dogs or our jobs, or, the quiet times. That's why nights are so hard sometimes, sleep, because when we're sleeping or trying to sleep, that's when all the stuff bubbles up. So I would notice it, I'd name it, and I'd share it if it's appropriate with someone. And just, I don't have anything more to say about that. I think it's great.
Yeah, I would add that this goes back to our discussion of the brain earlier, where, I can speak for myself. I had spent 25 years in active addiction, shutting down every feeling I had. So my only feelings were fight, flight, freeze. I was stuck in the midbrain, all of the executive function of knowing what I'm feeling and processing in an emotionally intelligent way. Those pathways were shut down for me, and I would think that's where you are. And at about the 3-month mark, I noticed that I would just cry. I'd see a commercial on TV and I would cry, like a McDonald's commercial, not even a Hallmark commercial, and I just started crying because I was feeling something and I didn't know what it was, and it was just overwhelming. And all I could do was just cry because it was just too much. So yeah, been there, done that. You're on the right path. And
Totally.
David mentioned the chart with the emojis that we have in our treatment center. I had one of my therapists who he gave me a chart of those before emojis were called emojis, but with little words like, feelings under these pictures, and I had to use that to figure out what I was feeling. I wish I had done some Gestalt. That would have been kind of, I would have thought it was stupid as hell, but I probably would have gotten something out of it. And now I love things like that, but that's now.
Yeah.
So,
to me, these emotions, they're one of the joys of recovery, because I was basically emotionally dead in my addiction. My addiction masked all that. And so, that waking up and knowing you're alive is really quite wonderful. Even to the feelings, and I had a lot of pain and sadness and grief that also came along when I woke up. But even that, I took kind of a joy in feeling. Yeah, great.
Thank you, everybody. We are out of time. David, do you want to say anything about patience or anything else to take us out?
Yeah, just remember, addictions are all about this fight or flight, numbing, seeking intensity to distract ourselves. And so patience is really the antithesis of all that. And we just need to breathe and settle in and be, be, not do, I guess. And just, just feel those feelings and breathe and stay connected.
Thank you, David. Thank you, everybody, for being here and your great questions. We'll be back next week at 5 p.m. Pacific on Wednesday. And we hope you'll be here too. We'll see you then.
Thanks, everyone. Good night. Good night, Scott.
All right.